Mr. President, what I come to the floor to speak to is another issue that really calls on the Senate and asks the basic question, why are we here? I think we know that we were elected to make America a better nation and to help families across this nation realize the great opportunity and goodness of this nation. So one of the issues that most people worry about the most in their daily lives is health care. They should. I've said on the floor many times, if you have ever been in a position in your life as a father of a seriously sick child and you had no health insurance when that happened, you will never forget that as long as you live. I know, I've been there. And I went through a period of time with my wife raising our daughter when she needed the best medical care in America and we didn't have any health insurance. It was frightening to think what would happen to our little girl because we didn't have the protection of health insurance and the quality care that everybody wants for themselves and for the people that they love. So now we're in a debate now, at this moment in time, about the future of health care in America, the future of health insurance in America. I can't think of a more serious topic. People say, well, it's 1/6 of the American economy, our healthcare system. That's critically important. But even more so, this is such a personal matter for every individual. Now, the Affordable Care Act, which was passed 6 or 7 years ago, I was proud to vote for. We couldn't get any support from the other side of the aisle, not one single vote, not one Republican vote in support of it. Our goal, of course, with the Affordable Care Act was to reduce the number of Americans who were uninsured when it came to health insurance. We achieved a major part of our goal. The rate of uninsured under health insurance in America was cut in half by the Affordable Care Act. We expanded opportunities for health insurance through the Medicaid program, as well as through private insurance exchanges. We're moved in the right direction. And we said something else. We wanted to build into the health insurance system of America protections for families. We wanted to make sure that you couldn't be discriminated against buying health insurance simply because someone in your family had been sick. Think of how many of us, 1 out of 3 I might add, have a pre-existing condition or someone in our family with a pre-existing condition. It happens. A child surviving cancer, a child with diabetes, somebody in the family who has a heart condition. Those are the realities of life for families across America. And before the passage of the Affordable Care Act, the health insurance companies could say to you, not only no, but really no, when it comes to coverage. Or they could charge you premiums, which were way beyond what people could afford to pay. We eliminated that in the Affordable Care Act, eliminated it. You cannot discriminate against an American on the basis of a pre-existing medical condition. The insurance companies had gone wild defining what a pre-existing condition was that might raise your premiums or deny you coverage. Acne in your adolescence, pre-existing condition. The fact that you are a woman who might give birth to a child, pre-existing condition. The list went on and on. We eliminated that and said you cannot discriminate against Americans because of those things. Now we have people on the other side who've said, well, we've got to get rid of that protection. If we do, what will happen to all of these people? On Saturday, I went to a march in Chicago at Lincoln Park. It was the Children's Heart Foundation and the Congenital Heart Defect Alliance. And of course, it speaks for itself. The number one birth defect among children in America is heart defects. 1 out of 100 babies born has a heart problem. These are kids with pre-existing conditions, and you should have seen the families show up in big, big numbers, supporting little kids, some of them just babies. They were proudly wearing T-shirts, standing up and saying, we're going to fight for this little boy or little girl, trying to promote medical research to save their lives. It's something that really touched me as I looked at 600 people on that hot Saturday afternoon marching in Lincoln Park in Chicago. I said to him, you know, when it gets down to the basics in life, the most important thing in your life is your baby. The next most important thing is the family that you have standing behind that baby. And then there's that doctor you're counting on to do everything in his power or her power to make sure your baby survives. But you need to bring into this conversation another group, politicians, senators and congressmen, because we are making decisions right here in Washington that will decide whether the families that marched in Lincoln Park in Chicago on Saturday and families like them all across America will have access to affordable health insurance, real health insurance that will cover them. That's what the debate's about. It was just a few weeks ago that the House of Representatives passed a measure to repeal the Affordable Care Act and to replace it. At the end of the day, not a single Democrat voted for their measure. It passed by 2 votes in the House of Representatives. And when they came back and analyzed what the Republicans had voted for in the House of Representatives when it came to health care, here's what they found. Their proposal to eliminate the Affordable Care Act, the one that passed the House of Representatives several weeks ago, according to the Congressional Budget Office, nonpartisan expert group, according to the CBO, 23 million Americans would lose their health insurance under the plan that passed the House of Representatives. And in my state of Illinois, 12.5 million people in our population, 1 million people would lose their health insurance. I'll just tell you, I don't see how any member of the Congress can stand before us and say, I've got a great solution for health care in America. We're going to take health insurance away from 23 million people. But that's what their vote did. And their vote, sadly, eliminated the protection against discrimination because of pre-existing conditions. So what has been the reaction to the House repeal bill that was passed? I can tell you in my state, there's not a single group, not one, medical advocacy group that supports what the House of Representatives did. I'm from downstate Illinois, outside the city of Chicago. Had a congressional district down there, small town America, great people. If you went into that part of Illinois and said to them, I'm going to vote for a measure that's going to put in jeopardy the future of your local hospital, the people would literally rise up to resist it. The Illinois Hospital Association tells us that the Affordable Care Act repeal, passed by the House of Representatives, endangers hospital services all across our state, but especially in small town and rural America. They estimate that we are going to lose 60,000 jobs at these hospitals in our state. I can tell you what those hospital jobs are in small town America, in rural America. They're the best jobs in the community. These are medical experts, doctors and nurses, and supervisors and administrators who keep these hospitals operating, and they're paid well to do it, and they should be. Those are the jobs at risk of being eliminated by the vote of the House of Representatives. 1 million people in our state to lose health insurance, and our hospitals threatened with closure. That's why the Illinois Hospital Association opposes what the Republicans did in the House of Representatives. And that's why the Illinois State Medical Society, our doctors, and the Chicago Medical Society have come out against what happened in the House of Representatives. That's why the nurses have opposed what was passed in the House of Representatives as well. Not a single medical advocacy group supports what happened in the House of Representatives. Not one in my state. Can't find one of them. So now, you remember from basic civics, after it passes the House, it's our turn in the Senate. What are we going to do with health care reform? Well, I wish I could tell you. We're told we're going to vote on it. Maybe as soon as 2 weeks from now, we'll come to the floor and vote on changing the health care system of the United States of America. What is the proposal of the Republicans in the Senate when it comes to the future of our health care system in America? I don't know. And the reason I don't know is it's being done in secret. There's no committee hearings. There's no opportunity to offer an amendment. In fact, we haven't even seen the measure we're going to be asked to vote on in 2 weeks. The Congressional Budget Office, which is supposed to analyze it, hasn't published any analysis of the Republican plan. And yet they are moving forward at a breakneck pace to have us vote on it, up or down, before we leave for the 4th of July recess. It's a frightening prospect. And they will do it under what's known as reconciliation. I won't bore you with Senate procedure, but what it basically means is they can move it through with a simple majority vote in the United States Senate. Amendments will be considered on what they call a vote-a-rama basis, and if it sounds like some kind of a game, it's almost a game. You offer an amendment and you get like 1 minute to explain your amendment on changing health care in America. The other side gets 1 minute to explain their opposition, and off you go to a vote, and then another one and another one. Your head's spinning, trying to figure out what in the world each of these amendments, each of these votes are going to mean. And those are the measures to be taken by the Senate when it comes to health care. This is exactly the opposite of what happened when the Affordable Care Act was passed. Do you know that we adopted 160 Republican amendments to the Affordable Care Act? None of them voted for final passage, but 160 amendments were offered by Republicans to change it, and they were adopted. It was a bipartisan process on the amendments. How many amendments will we be able to offer to the Republican Senate proposal that's going to come before us in 2 weeks? The answer is we don't know, because we've never seen the Republican proposal. It's been done in secret. 13 Republican senators were chosen by their majority leader to sit in private and come up with this bill. There was no open committee hearing, no open discussion. Some Republicans were invited in, some were not. And we don't know what the ultimate product will look like. But I can tell you this, whatever the Republican senators come up with, it's going to have a dramatic impact on each and every single American, every one of us in our communities back home. This idea of repealing the Affordable Care Act in 2 weeks, I know, is a solemn political promise which many Republicans made. But they also made a promise to the people they represent to do what they can to help these families through their difficult times. And that's why we need to ask to make sure that the product that is passed by the Republicans in the Senate is one that serves the needs of people across the United States of America. If this is a product coming out of the Republicans, like the House measure, that takes away health insurance for 23 million Americans, then I can understand why the Republicans want to do this in secret. I can understand why they don't want us to see it until the very last minute and then vote on it and get out of town as fast as you can, because it's an embarrassment to think that the United States Senate and the House, for that matter, would vote to take away health insurance from 23 million Americans. That is a dereliction of duty, and from where I'm sitting is just flat immoral to take away health insurance from that many people. And what if we end up with a product like the House of Representatives that jeopardizes rural hospitals and hospitals in the inner cities, that closes down these community health care clinics, reduces access? Well, I'll tell you what will happen. People without health insurance will still show up at the hospital sick in the emergency room, and they'll still be treated, but they won't be able to pay for it. Who will pay for their care? We will pay for their care. Everyone else with health insurance will pay more because people uninsured will receive free medical care. That is a reality. And of course, if you don't have a regular doctor, a regular medical home as they call it these days, what started off as a minor problem could turn into a major problem, even life-threatening. That's why the Affordable Care Act builds into it community health care clinics and opportunities to create a medical home. When I met with the Chicago Medical Society at a convention that they had in Chicago this last week, I was surprised by a few things. First, I was surprised to learn that out of the 5,000 physicians in the Chicago Medical Society, they'd received responses back from over 1,000 who said that they thought that the measure that passed the House of Representatives, the Republican repeal bill, was the worst news they'd heard when it came to the future of health care. They preferred the Affordable Care Act. But they went on to say something which may surprise people. These doctors said, over 1,000 of them responding to the survey, said they thought it was time for us to talk about really significant changes to our healthcare system in America. They're tired of fighting the private insurance companies. What they suggested is that we look at a plan like Medicare for all. Right now, Medicare serves 50 or 60 million Americans. People can't wait to turn 65. They finally qualify for Medicare, no exclusions for pre-existing conditions. And they know that Medicare is going to give them quality care, and it's not going to bankrupt them as individuals. These doctors in the Chicagoland area have said it's now time for America to seriously look at Medicare for all. And I agree with them. I think it's time to look at it. Because the private health insurance system, as we tried to save it, salvage it, remake it for the Affordable Care Act, has real shortcomings. And I hope that those on the other side who are considering changes in our healthcare system will actually listen to doctors, listen to hospital administrators, and listen to the families they represent. Why they are doing this in secrecy, why they are refusing to give us a chance for committee hearings and amendments, I can't tell you, other than the obvious. Clearly what they've come up with is something they don't believe the American people will accept. So they need to push it through without disclosure at the last minute and get out of town in the hopes that people won't blame them. Well, when it comes to health care, people don't forget. I won't forget, and the people of Illinois won't forget the votes that were cast in the House of Representatives, which threatened to take away health insurance from 1 million people in my state. Mr. President, I yield the floor.